Hi guys, it's Sasha, and today we are going to go over chlorhexidine baths. That was my presentation. But before we start, I certify that this is my own work. There is no plagiarism, and anything that I have compiled, all data, it is backed by references. So every day, patients come into the hospital and they require some form of surgery. Um, and there's steps taken that prevent infection prior to surgery, but there's not definitive standards for after surgery. Chlorhexidine gluconate baths were created to kill bacteria on the skin preoperatively. However, many facilities do not continue the baths postoperatively when the risk for infection is greater. Preventing infection and reducing readmissions rate is important for the overall health and safety of our patients. Rewriting policies and procedures to achieve the goal is paramount in the overall health and safety of our patients. The biggest achievement for me in this with this project was kind of twofold. Of course, I needed it for this course, but it was bigger. I wanted to join the hospital's policy writing committee. When I read a lot of our hospital's policies, they're all physician provider driven. There is not a lot of nurses input. They always ask for nurses to join, but nobody takes the steps in joining. And I knew that I wanted to take the steps in joining because, again, there's certain policies that I feel, could be better, but they're not quite there. So the achievement of this was to create a training that requires a hard look at current policies. And doing this training, it did require a hard look at our current policies. I had to gather information on on how the policy is met with action, in which it's kind of iffy at best. I had to gather research and evidence-based practice that reinforces the policies and procedures. And I had to dig deep because there's mountains of evidence-based practice, but there's not a lot of practice put to that evidence-based information. And I had to conduct training and monitor evidence of training. With joining the policy writing committee, I have to do this over a 6-month period. So this was the start of this for me to actually join. I had to gather further data on the policy committee and the requirements to join. And one of the biggest requirements was complete and submit the application, a submit request to management to join the committee, and submit required proof of training to the committee. So on top of doing it for this course, I actually had to do it for the facility to show what interest I'm in and how I would contribute to the committee. But also because of where I work on a cardio step down unit, and most of our patients come in for cabbages, TAVRs, MVARs, cardiac catheterization, and they require chlorhexidine baths. But what happens after the surgery? And our policy does not state what happens after the surgery. The second achievement was clinical management involvement. I had to gain the support of the clinical management for endorsement to join the policy writing committee. And it's not as easy as it looks because sometimes as a new grad nurse, you kind of get that, why are you trying to rock the boat kind of, you know, from leadership. But I think for me, it was met with, well, what do you want to do? What are you going to do? Show us what you want to do, and we'll go from there. And by gaining the support and getting clinical managers involved, it required me to conduct an in-service using the policy that is currently under review. Our chlorhexidine policy is still under review because um, all the other elements that go with it, i.e., the reduction of readmissions and as well as infections. And so I needed to be able to show that something as simple as CHG baths post-operatively could have better results for our patients. And I had to create a comprehensive plan to better the unit and reduce infection. And again, the committee gives me 6 months to show data. So I have some data, but not as much needed for that, but it's still an ongoing process. And providing evidence of my theory based on evidence-based practice and research. And we have started and implemented a few things, but again, it's a 6-month process before I actually have data that is tangible. Um, Now the completions of my strategies is, first I did an in-service and I conducted training for day shift and night shift. Now we're a 14 bed floor, so We have on staff typically for day shift 3 registered nurses, 2 patient care techs, and 1 huck. At night, we typically have 3 registered nurses, 1 maybe 2 patient care techs, and typically we have no huck. So it wasn't going to be a large group of people that were going to be at the training, but I did the best that I could. So I created a PowerPoint slide that basically, gave us what chlorhexidine is. It broke down the history of it when it became recognized by the FDA and the steps that we should take. I did a pre and post quiz and conducted just to test their knowledge on chlorhexidine. And it wasn't an I gotcha moment, but it was more of a, okay, let's see what your knowledge is. Why do we give this? Do you understand the importance of it? And then visual aids. So the visual aid I provided, which I have linked below, is a video. And in the video, it just tells you exactly how to do the chlorhexidine bath. If you have a non-ambulatory patient who is bedridden, we have wipes that we provide, and it tells you the direction in which you wipe. If your patient is up and able to shower, we do have the chlorhexidine body wash where we tell them what to wash and what not to wash when they get in the shower. Also, for my completions of strategies, put in the MUSC policy. I linked the MUSC policy required CH Baths and policy learning course. So I got early access to the yearly organizational training for everybody so that we could do it at that once. And I posted the MUSC policy on the boards throughout the unit. We did not have the policy on the CHG Baths listed throughout the unit. We have them on checklists for our CV surgery patients, but although we are a cardiac step down unit, oftentimes we do get patients that are from other services. And if they're having surgery, they still require the same things. So it should be universal, the chlorhexidine baths. So that's why I posted it. And then audited documentation on CHG baths. The issues that I found is there's not always accurate documentation on the CHG baths. If the techs do it, that's not a part of their documentation, so it doesn't get documented. So oftentimes it looks like the chlorhexidine baths are not being done. And like we say in nursing, if it's not documented, it didn't happen. So my audit revealed that there are oftentimes more than not CHG baths are not being conducted. And again, that may be further from the truth, but without the documentation and going through the audits, we found that it just was not happening. So the outcomes for the nursing unit is a reduction of readmission due to infection. We have had a few in the past few months of patients coming back where they had their mid-sternal incision, had drainage, and they ended up having infection, or their IMA or their EVH, which is the grafting from their leg, has gotten infected, and they've had to have wound vacs and whatnot added, which again, they have to come back to the hospital, so we're not reducing our readmissions. So the purpose is to reduce so that we can, have less people coming back. Increased documentation, ensuring that even if the patient care techs are able to do the chlorhexidine baths, they're able to document it. So giving them that authorization, that part of Epic, so that they can document it, as well as creating something in Epic where we can constantly document it. Increase quarterly training, because our floor, we do work with surgical patients and we do post-op patients. We do need quarterly training on CHG baths. And implementation of improved policies and procedures. So once the policy needs to be improved, and we need to implement that for better outcomes on our floor. Um, in practice for me, in practice, for this to be effective, is to continue the pre-op CHG baths at 10 p.m. the night prior to surgery and at 5 a.m. the moment of surgery. CHG baths post-operatively when they're in the surgical recovery unit. For instance, they're being extubated and they're not in a sterile environment of the operating room anymore. So why not wipe them down with CHG baths before they come to the floor? CHG baths once per shift and document in Epic. So each shift, the patient should have a CHG bath. If they are able to move, we have the body wash that they could use. If they are not, we have the wipes that they can use, and it should happen each shift. Mainly because when they come out of surgery, they have IJs in. They have chest tubes in. Some have PICC lines. They have Foley's in, and those are all different ways to introduce bacteria into their system. And we have impregnated chlorhexidine impregnated caps for the IJs. We have the chlorhexidine impregnated catheters for the IJs, but we need to also be cleaning their skin as well because bacteria does build up on the skin. CHG body wash provided at discharge. We have the bottles of CHG body wash. We need to be providing this at discharge. Quarterly with training with skills check off. It should be a skill check off that we practice the proper way to give a CHG bath. And then yearly training with the certificate provided so that we stay up to date. The value to me of this project is it enhanced my research methods to enhance nursing skills and knowledge. I had no idea everything that was involved with CHG, and doing this project, it helped me to enhance my knowledge, thus, educating my coworkers, whether they really wanted to or not. Um, the value of this is policy writing and implementation for the betterment of my unit. If me joining the policy writing committee, coming from a nurse's perspective, could help tremendously with nursing staff at our hospital as a whole, but more so for my unit, so that we have our voices heard when it comes to making these policies because we're the ones that implement the policies. Um, for me, this is bringing value because it's going to have me constantly monitoring for changes with laws that affect practice and continuing education to remain informed, whether it be going for a higher degree or just continuing education. The value this project brought me is gaining more knowledge. And this is my references. So if you have any time, you can click on any of the links and read any of the articles. Thank you.